En 1996, le Dr Calvin Gutkin est devenu directeur général et chef de direction au Collège des médecins de famille du Canada. Depuis, Cal a mis toutes ses connaissances, son expérience, sa passion au service du Collège afin de mieux répondre aux besoins changeants des médecins de famille et de leurs patients, et ce, partout au Canada. À la fin de l'année, nous allons saluer Cal au moment de sa retraite. J'ai eu le privilège de travailler avec Cal pendant plusieurs années. Je suis certaine que son leadership, sa passion, son amitié et oui, même ses talents de chanteur nous manqueront. During his time with the CFPC, Cal oversaw the evolution and elevation of both the college itself and the discipline of family medicine. It was under his guidance that family medicine came to be recognized as a specialty in Canada. During his tenure, the number of college members as well as the number of staff more than doubled. Cal established Family Medicine Forum, which quickly became Canada's premier family medicine conference. Cal enhanced advocacy activities in the college and strengthened the value of family physicians across the country. Avant son départ, nous avons discuté avec Cal des années qu'il a passées comme chef à la direction du collège. Nous vous proposons une série en 4 épisodes qui relate les défis qu'il a affrontés, ses réalisations et quelques détails sur ses projets d'avenir. Please stay tuned for Part 1 of Conversations with Cal, In the Beginning, Part 2 of Conversations with Cal, Reaching the Milestones, Part 3 of Conversations with Cal, The Challenges We Face, and Part 4 of Conversations with Cal, The Next Chapter. Enjoy!
Since you began as Executive Director and CEO in the mid-1990s, what were the significant changes to the state of healthcare in Canada?
I think in that time, though, there has been recognition, without a doubt, in more recent years of the importance of primary care and family practice as part of that. To the stability and the value and quality of a healthcare system, of our healthcare system in Canada. So we have had an opportunity working with governments across the country to further the role of family physicians and the contribution family doctors make to primary care. It's been, I think, more clearly understood by our policymakers, by our governments, by elected and bureaucratic individuals in government that primary care and family practice have a significant role to play. So that's given us an opportunity, and I think we have actually taken that opportunity and moved on it and had opportunity to work with governments and work with other stakeholders to be able to develop a more well-established kind of place for family doctors across Canada.
In bringing the college to that point, what were some of the major milestones that the college has achieved during your time here? What are the things that stand out in your mind?
Well, there are many things that have happened, and again, many stakeholders and players who have contributed to this happening and that I've been privileged to be part of during my years in this position. And they involve two very important parts of what we do as a college and what our discipline is all about. One of them is the academic family medicine base, and the other is the things that we have to address related to the practice environment. They both have politics that are linked to them, but who we are and what we are depends very, very prominently upon who and what we are as a discipline, and how we are seen within academic family medicine, how we are viewed by that entire community, our peers who are teachers and researchers, our students who are looking at future careers and trying to decide whether this is a credible discipline to be part of. It's very important for the political part of our healthcare system to recognize the importance of family medicine and the support for it in the academic environment. And we went from a low of 23% of medical students selecting family medicine as their first choice in 2003, back up to just over 35% this past year. We do need 40% of medical students to be selecting family medicine, to be training in family medicine, to maintain 50% of the practice population being family physicians, to be able to deliver the needs that the population has. So that's been very good for us. Part of doing that, as well, is that our college realized we had to reach out to medical students. We not only had to support their teachers and the academic environment, we had to support medical students and make family medicine a more attractive career for them. So amongst the things we've done in the college, we established a section of medical students so that medical students have a home in this college. They are on our board of directors with voting seats. We supported family medicine interest groups in all 17 schools across the country. We have brought medical students into our other committees. We have listened to them. We have participated with them. We've been out at the medical schools. They've been part of us. And I think all those things have contributed to medical students being more interested in family medicine. We've also been an advocate for better support for family practices and for moving in the direction of the kinds of things our population needs to have better care provided for them. And medical students have seen that. They've seen that in many jurisdictions, family physicians are now able to have incomes that are a little closer to some of the other specialties. They've seen that the practice environments are talking about supporting primary care and family practice. They see new models of care coming to be, models of care which we have been talking about for the past few decades and that we've continued to build upon in the last number of years. We developed a group that is for the first 5 years in practice, that is relatively new but is becoming quite a dynamic group. The challenges that occur for family physicians at that point of their career where they're just starting out, we now have a focus on that in the college so we can help to support them. We've looked at the challenges in academic medicine, family medicine. We've looked at our curriculum for training. Is our training program adequate to meet the needs of both urban and smaller rural or remote communities? So we've now introduced a new approach to curriculum in family medicine training, the CCC curriculum, which is competency-based, based on everything being focused and centered in family medicine, comprehensiveness and continuity of care, the traditional defining landmarks that mark what family medicine is all about remain and will be more firmly supported in the future. Well, family medicine is now a specialty in Canada, and it probably has been for many decades, but it is a specialty. It has its own unique, easily defined body of knowledge, a research base, and a commitment to lifelong learning, a commitment to quality outcomes in practice, all the things that every other specialty has. And family doctors deserve to have the training that they've had in their discipline recognized through certification, through recognition with a special designation that tells the rest of the world that they are specialists in family medicine and that they're going to be committed to maintaining the competencies through maintenance of certification in their specialty.
What do you feel is your greatest accomplishment during your time at the college? What are you most proud of?
Well, there are a few things. I think that our team that has worked together while I've been in this role and part of it that I will always be proud of for what we together have achieved. I think some of the things we've talked about with regard to medical students and residents and their role in the college, continuing to build the role of chapters and supporting chapters, and that's something that has to definitely carry on. I think building the community of family medicine, which took and takes many different kinds of components that have to be put together to do it, was very important. We were concerned about the fact that in the mid-1990s and around the time that I assumed this role, that we were separating off our teachers and researchers and the practicing physicians into different communities. We saw that our annual meeting, which was always a very good meeting, was drawing around 500 registrants per year. So we created Family Medicine Forum, and the first year we tried that was in Ottawa in 2000, and we had 1,001 registrants, which was over double what we had had before, and it continues to grow. And it's not just the numbers that are important, it's the dynamic of the meeting, and the feedback is so positive. It happened through a time when many other organizations saw their meetings getting smaller, and some were even discontinuing them. But Family Medicine Forum is now vibrant. I mean, last year in Montreal, we had 4,300 registrants. We had an exhibit hall, which is 2/3 of it is professional organizations and continuing education groups and medical schools, and it had grown from 16 exhibitors to over 200. And again, I'm not suggesting this has to continue to grow in numbers that are going to become unmanageable, but it is dynamic and it has created a community. And I think that's very important. Work that was done leading to the Patients Medical Home Initiative, which I think is going to be front and center for the next decade as the guiding model, the guiding light for the models of primary care and family practice. I think it has all the component parts in there that the people of this country want and need. And family doctors are central to it, working as part of teams. And team-based care is the future. And we have to recognize that, and it's part of this model. Those are certainly some of the key things that I think have happened over the last while.